Welcome to the weekly dose of self-care, where you learn a medical condition in 5 minutes. Today, we're going to talk about allergies. You might have symptoms of allergies if you're feeling itchy, you're sneezing, your nose is either blocked or runny, or red water your eyes as well. You will need to see the doctor when your symptoms start interfering with your sleep or daily activities, or for some reason the symptoms are greater than 2 months. An easy way of improving your allergy symptoms is to stop smoking, especially when an allergy causes a lot of runny nose. Smoking will actually make that even worse. Next thing is try to avoid triggers or allergens that cause the symptoms. Now I will go through which medication could be used for which allergy symptoms. If you have stuffy nose, you have 3 options to choose from. The first thing is Hydrosense nose spray. It's basically just saline, which is salt and water. And the way this medication works is that it forces the saline up the nose to clear any blockage inside the nose. So the effect technically works immediately. The next one is glycerol, which is another nose spray, but this time it is actually medicated, and the effects will kick in within 5 to 10 minutes and will last 12 hours. The important thing to remember about this one is that you have to limit the use of this medication to maximum 3 days in a row. The reason for that is if you were to use it beyond that, it actually makes the stuffy nose worse. Now the last thing is a reactant complete, which is a tablet that contains both an allergy pill as well as a stuffy nose pill. So it will work within 30 minutes and will last roughly 4 to 12 hours. But it's very important for those who have blood pressure control issues that they stay away from using this medication. Using your nose spray properly is also very important. The first thing to do is to blow your nose. Then you shake the medication bottle and remove the cap or lid. And with the head still upright, press one finger against the nostril that you're not inserting a device into. Then you squeeze the bottle and you breathe in slowly. Then you just repeat it with the other nostril. If you only have the symptoms of runny nose, then nothing over the counter will be effective for that. The best thing is to just go see the doctor to get a prescription where you can get a nose spray. If you have a body rash or itch that won't go away, then you can try either Allergies, Reactant, or Benadryl to help with it. All of them work within 1 hour, but Benadryl makes you sleepy, while the other ones don't. The next thing is that if you also happen to have a stuffy nose, the Allergies will help out with that. But if it's a runny nose, then Benadryl will be the one. If you tried everything else and they failed, then you can try a nose steroid, which is the strongest of all the options out there, except for emergency situation where you can't breathe, you swelling, and so on. But usually it works within 6 to 8 hours, then the maximum effect will kick in a couple of weeks. Here is just a summary slide of what we talked about, but I did want to highlight that if you have runny nose, sneezing, nose itchiness, stuffy nose, or eye symptoms, then you can use Reactant Complete. And if for some reason it does not help, then you can move on to the nasal spray Flonase. If you like what you're hearing, remember to subscribe and like, and I'll see you next Saturday at 8 p.m.